How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me are all made of DNA. We're all made of the same chemical DNA. We're all made of DNA. We're all made of the same.
Hello, you're listening to DNA Today, a genetics podcast and radio show. I'm your host, Kira Deneen. DNA Today informs you on what's happening in the genetic world. During my broadcast, I educate the public on genetic and health topics through event coverage, news stories, book movie reviews, and interviews. Guests include genetic counselors, researchers, patient advocates, and professors in the field of genetics. My guest on today's show is Dan Faszczyk. For years, Dan held executive commercial positions in healthcare with a specialization in genetics. He worked with leading companies like Myriad and Sequenome and labs from all over the world. His experience and insights led Dan to found Kolgene, a platform connecting clinicians with genetic labs around the world to streamline the process of looking for labs, communicating with them, and ordering tests. So thank you so much for coming on the show.
Thank you for having me. It's great to be here.
So our main discussion is going to be about physicians ordering genetic tests. But before we get into that, I want to hear more about Kolgene and how you started the company.
Yeah, well, there are two stories, I think, that led me to think about a solution that Kolgene offers. One of them, it was a few years ago when I was VP Marketing and Sales for a genetic testing company. And one day I got a call from a worried father. His son was about 4 years old at the time and was suffering from muscular dystrophy. The boy was about to undergo a surgical procedure as part of the diagnostic process. And the father just heard that there might be a genetic testing, a non-invasive test to replace the risky procedure. He called me, he wanted to know if that's available, and of course I've confirmed that the test was available, and the boy was tested the next day without the risks and in comfort of the surgical procedure. And I started to think to myself, why didn't the boy's doctor inform the family about the existence, about the availability of this test? And in order to understand that, we need to look at what's happening in the genetic test market. And the other story is part of what's happening in this market, and that's when a clinician, a geneticist, actually told me that he just the other day he just finished providing counseling to a family. They needed a test that he didn't order before. And he needed to spend like hours on the internet to find, looking for labs, finding a lab that can do the test, and then communicating with it, in order to be able to offer the test for the family. And that actually led me, to look again on the market. And what we see in the genetic test market is that more and more clinicians from various medical expertise are starting to use genetic testing in their regular routine practice. And at the same time, you have more and more genetic labs that, startup companies or more, the older companies in this market are 3 to 4 years old, who offer genetic testing. So if you have more companies with more offerings, and those offerings are changing constantly because labs are investing a lot in improving their offers. So that's what led me to think about Kolgene, a platform that will address this pain, this need to streamline the process of finding labs and order tests.
And so from all this, you kind of were inspired to start your company and help bridge that gap between clinicians and physicians ordering genetic tests and being able to find that and not spending hours and hours just searching kind of aimlessly until they find something. So how has this company kind of changed things? What's your setup to help?
Yeah, so I think you're touching the point. The thing is that in other aspects of our lives, we're using technologies to order a taxi, to book a room at a hotel, or get a whole lot of services in completely different ways. So I thought to myself, why not implement that and use that in the genetic test market? And so what we've created is a digital platform that allows clinicians to place the request for a test in less than a minute. We've streamlined the whole process. So they place the request with all the important information on one end, on their interface. On the other end of the platform, we have a growing number of labs from all over the world who are then getting the request and can customize the offers that they can extend to that specific clinician, taking into consideration, their turnaround time, the medical condition that they want to test for, a lot of factors that they want the clinician to consider when making an informed, well-educated decision on which lab to send the test for. And that's in a nutshell the way the platform works. So it's finding labs, communicating with them, and eventually ordering the right test for a specific patient at the right time.
So, and it's kind of like Kayak for hotels. Instead of going on each hotel's website and finding their best deal, you just go to Kayak and kind of search, and everything comes up. So you're the Kayak of the genetic testing world.
That's excellent. Yes, in a way we are. I've just talked with a clinician from Texas last week, and she told me, for every new test, she has to spend hours on the phone calling labs, and that's too much. That's time units that are spent by clinicians on doing something else other than treating their patients. So I think that's a very good analogy to all those other platforms that we use in our everyday life to improve the service that we get. We don't want to go on each and every website because there are dozens of websites, and you can't necessarily find all the information on the websites. You need a different channel. And I have to say that for labs, labs don't want to publish all the information online because, first of all, they don't want to publish their prices. And then when you, as a clinician, when you're looking for a lab and you're looking for a very specific test for this specific patient, you might not find the test that you're looking for on the lab's website. But that doesn't mean that the lab cannot do it, because if a lab has a sequencing platform, let's say the NextSec and above, the HiSec for sure, the software and the manpower, they can do anything from point mutation to whole genome sequencing, but they're not necessarily publishing, a specific panel of 10 genes that are relevant to neurology or any other disorder.
And so this helps with kind of finding maybe which panel is appropriate, because there's so many different panels to choose from if a doctor is going off of maybe not too much clinical information of, all right, I only have this, so which panel is really appropriate for my patient, that maybe it should be a larger panel if they don't know as much.
Exactly. So, they can be, if that's a very knowledgeable clinician and he can tell, he can put in, I'm looking for an oncogenetic panel. It has to include specific genes. That's one option. The other option is, someone who's just starting to order genetic tests and is looking for, a panel for cardiology, but it doesn't have to be specific. He just want to see what's out there, and then according to the offerings that he's getting, he can choose the best one for him. For instance, we are encouraging labs to include in their offers a demo report, and that's a very useful and powerful tool for the clinician to order a test, because especially for those who are just starting to use genetics in their practice, because they want to know what to expect. You don't want to be a clinician doesn't want to be in a place where they're ordering a test and then they don't know what to do with the report. That's a very frustrating place to be in, especially when someone has already paid for the test. You can't go and do another one as you please.
And you have more of a full picture by putting all this information together. And as you said, at certain websites of labs, they don't include all that information, including prices. I know I've looked for just pure interest, and you can't find a lot of that information, and it can be frustrating, especially in terms of looking at insurance coverage, and that's a whole nother layer that's thrown in there. Do you cover that on your website if something is compatible with a certain insurance, or is that kind of another beast?
So that's the next step. But already now, because Kolgene is a very flexible and responsive platform, you can, as a clinician, indicate in your request that you want the offer to come from a lab that works with a specific insurance company, or there are those labs who offer something that they call an insurance exploration or investigation to provide more information for the clinician when making the decision. So yes, this is the next step, because the market, especially in the U.S., is so complex with reimbursement, both for labs and for clinicians and patients. No one want to have a surprise billing for a test a few months after we had it. So yes, this is an issue we are addressing that as well.
So what is the actual process of when a physician kind of logs onto your website and goes into the platform? Where do they start? Is it kind of guiding you through of what the patient history is and kind of guiding as to what genetic tests they should use? Or do they need to know a little bit more than that?
So right now they need to know a little bit more than that. It's very it's self-explanatory. It's very simple to use. They can download an app, the clinician themselves or someone in the clinic or hospital. So they can download the app, or they can use the web interface. And then they need to put in the name of the test, as I said before. It can be something very specific or something general. It can be, they can say, I'm looking for a genetic test, a panel for cardiomyopathy. It can be, I'm looking for a whole exome or whole genome sequencing, or single genes. I have to say, from our experience right now, the requests are beginning with, if it's a single gene, it's going to be like one of the big ones. Next parameters that they can fill out are the desired turnaround time, what kind of regulatory approvals they want the lab to have, if they have a preference for the lab location, if they have more than one sample to send out. And all that information is actually helping the labs to better customize the offer that they will extend. So the clinician needs to know, at least generally what he's looking for. I want to touch another thing that you've mentioned. What happens with clinicians who still need the support of a geneticist or genetic counselor, but they don't have one in their clinic? And so in this situation, some labs, especially in the US, now offer support from genetic counselors, in-house genetic counselors. And you see, on the alternatively, you'll see more companies who are now offering support for clinicians and patients with genetic counseling provided as a telemedicine. They don't have to physically meet. They can do that over the phone or Skype and get that support if they need it.
And that's another aspect of genetic counseling that people may not think of, that if someone does know what genetic counseling is, which is more and more common as the field expands, that genetic counselors don't just sit with patients. That's maybe more of a traditional role, but you also have genetic counselors that work for genetic labs, like you're explaining, that aren't explaining things directly to patients, but are explaining things directly to the doctors that are ordering the genetic tests, because physicians are not as well versed in genetics and genetic testing. Some of them are, but many of them aren't as educated and have an expertise in it as genetic counselors. So there's that aspect of having genetic testing companies offering those in-house genetic counselors and helping with this process, because it's kind of new.
Exactly. And clinician can ask for it when he's asking for the test, and even if he's asking for it or not, the labs can indicate this is an added value that we provide to all of our customers, so all of our clinicians. So this is something that the clinician needs to, will take into consideration when choosing a lab. This is a lab that can offer me the full service, a complement, the test itself with all the needed the requirements that I've indicated, and also a complementary counseling provided by them, or alternatively, an objective, a third company to offer the service.
And looking at the other side of genetic testing, we're starting to talk about the lab portion, We have these doctors that are accessing these labs through your service of Kolgene, but you're also talking with labs to be kind of in cahoots with you to set up this kind of matchmaking service that you do. So how do you reach out to labs? How are you helping them?
So again, my background is from, as I've mentioned before, is working with labs, and right now it's a very competitive market out there. A lot of labs are coming up with their offerings, a lot of competition between the labs. Everybody's claiming, trying to shout the loudest, I'm the best. And they're all having investing a lot in marketing, having sales reps, etc. So this is the appeal for labs by using Kolgene, because using Kolgene, they have a unique reach to all those clinicians who are currently using or are going to use genetic testing in their practice. We're reducing significantly the test acquisition cost for the labs, because using Kolgene, they have this unique channel. You don't need to have a sales rep. Not that I'm saying that sales rep will disappear from the world. They won't. But still, because the market is growing so dramatically, you still need to have new channels for reaching out to all those clinicians out there. So for labs, it's very easy, because they don't need to upload anything to the platform, because it's responsive. They're only responding to requests. So they don't need to upload and then update their catalog and prices, etc. They just respond, as they do anyway, to requests coming from the field, from clinicians who want to perform genetic tests.
So it's saving them a lot of time and money.
Exactly.
Instead of explaining that and trying to sell it to physicians that it's already available, and that it kind of, if they're getting a lot of requests from your platform, that it's kind of all going into one place. I would imagine that it's not a lot of different requests coming in from multiple areas, which it is from different physicians, but it's all coming from you.
It's all coming from one channel. Yeah, so for them, it's also a management tool. I mean, it's a management tool for clinicians as individuals, for clinics, hospitals, HMOs, insurance companies on the demand side, and on the supply side, it's it's the same for them. A lab can see that they are seeing the request. They can adjust their offering according to the request. We already had a nice example with the lab that joined in. They were focused mostly on one medical area, clinical area, and then when they saw the demand, they said to themselves, we have the platform, we have the capabilities. Why not offering new tests, as those tests are being asked for? So it's a tool for the labs also to know what's happening in the market. And doing all that, we still do all that without exposing, the information that the lab doesn't want to expose, and the information that the clinician don't want to put out there. So it's not like a clinician who is joining. As I said before, joining is very easy. You just download the app or go on the website. But you're not going to get a lot of calls from all those labs that see that you're requesting a test. This is a unique, discrete, and exclusive channel between the clinician and the lab only gets the clinician's details when he or she accepting the offer from the labs.
And by having the labs kind of all be in this one platform, you kind of mentioned it, do you see this having a big impact on different genetic testing companies coming out with additional testing or more tailored or personalized medicine like testing, where maybe they don't just have test 1, 2, and 3, but they kind of have custom panels of different, let's add these genes, or even having prices starting to drop to be more competitive as labs compete with each other, because doctors can see, oh, wow, the first lab is much cheaper than the second, and it's the same product, which there's a lot of other factors in terms of what a lab is. But do you see Kolgene having this impact on the genetic testing market?
So that's a great question, and actually it's two questions.
Yes,
so
it is.
the first one, this is another pillar of Kolgene, because in the genetic test market, you're going to see labs that are offering a huge variety of tests. You already have labs with catalogs of thousands of different tests. But on the other hand, labs need to specialize. So you already have labs that are doing only neuro, or labs that are doing only cardio. And in order for labs, business-wise, to focus on one area or a very small number of areas, you need to have a very good reach to all those clinicians out there who needs those tests, because why it won't justify itself financially, to invest in a very unique and one medical clinical area. So with Kolgene, actually, they have this reach. They can be very focused and still have a reach to all those clinicians who are out there. And this brings me to the other point, which is pricing. And I have to say that from our experience, pricing is important, but it's not the first, it's not even the third factor that clinicians are taking into consideration. Because clinicians, when they're reviewing the offers on Kolgene, they will look at scope of the panel, what genes are included in the panel, who's the lab director, what's his reputation, what's the lab reputation. And they will review very closely the demo report, because they want to see that's, in genetics, that's a product. An additional factor that we've added in is rating, like you have in Amazon or eBay. So clinicians can rate the level of service that they've got from a lab. So when a clinician is considering a new lab, he knows that if that lab was highly rated, so it was rated by his peers, by other clinicians who use that service. And so I think, generally speaking, I don't see a lot of impact on pricing with the unique tests. With those tests that are becoming generic, and it's challenging for labs to claim why their test is better than others, then yes, maybe pricing will be a factor. But again, it depends on where the clinician and the patient are from, and the coverage that they have. There are countries where pricing is completely irrelevant. The government just pay. In other countries, it's out of pocket, so price is a main issue. It's different.
Another kind of advantage for labs to be a part of this is that they get that feedback from clinicians of maybe their competitors are getting better ratings from clinicians because of certain factors, and that lab can say, how can we increase our validity, or how can we change
their offerings, exactly.
Yeah, their offerings, and that report that they get back to say, is it user-friendly? Can doctors understand it? Yes, and this is another value for the labs. So it's just it's not like you're in a way dancing in the dark, right? You're just sending offers to doctors out there. You're getting no feedback. With Kolgene, you can get feedback. Your offer wasn't accepted for 10 times because your competitor's turnaround time is 14 days, where yours is 2 months. You're covering 10 genes, they're covering 25 relevant genes. The report is very, very clear to clinicians from various backgrounds. And sometimes, maybe you need to improve your pricing, or you don't need to do anything about pricing. You can maintain your current pricing, but you need to improve those other factors. So yes, this will help labs, big and small, to improve their offerings and their reach to the market. So now that you've sold clinicians and labs that you're the way to go, you're the streamlined process, how can they access you? How can they contact you, get the app? What's the information? They can go on Kolgene.com, that's for clinicians, and lab.kolgene.com, that's for labs. Clinician can just go on Google Play and Apple App Store and download the app and start using it. It's available, it's there. It's for them to use, and it's completely free for clinicians and patients, and also for labs. The model is very clear, very transparent. We only charge labs, and only when they're getting paid for their services. So it's, as I said, it's completely risk-free. No one's publishing any confidential information or sensitive information. No one needs to pay anything until it's only the labs who are paying. Only
when they're getting paid for their services. And even then, it's a percentage, a small percentage, one that does not affect pricing.
So really nothing to lose. Definitely check out
Exactly.
Kolgene.com. That about wraps up today's episode of DNA Today. Thank you so much, Dan, for coming on and sharing your expertise in genetic testing and kind of giving us an inside look into the market and everything that goes into that.
Thank you. It's been great talking with you.
So again, Kolgene.com is where you can find all this information and check out their app, and you can also use the website as well. If you want to learn more about the show, you can go to DNApodcast.com. And if you're a Twitter junkie like me, you can go at DNA Podcast, follow me there, and tweet at me and all of that fun stuff. If you have questions for me or Dan about today's episode or previous episodes, email in info@dnapodcast.com. Thanks again for coming on, Dan.
Thank you. It's been a pleasure.
Thanks for listening, and join me next week to learn and discover new advances in the world of genetics.
The genes of you and me, the genes of you and we're all made of DNA. We're all made of the same chemical DNA.